sort of the Department of Public Health. So when the Public Health Department notices a trend of a new virus or disease in Durham County, what percentage of positive test results of that said virus or disease do you need to see before you consider it an outbreak and alert the mass public?
Good question. Thank you for that question. I would just say it's not necessarily a percentage. It's more or less like if we know that it's there, we have syndromic surveillance mechanisms in place statewide and locally to allow us to take action. Case in point, I know many of you have heard of Mpox, formerly known as monkeypox. The minute that we heard that it was in North Carolina, we were on high alert. The minute that we knew that we had a positive case, just one, we in turn took action. In other words, sometimes I have to make hard decisions in putting out press releases to let the community know. With us being in the triangle, that also comes with a lot of media attention. So there's a whole lot of radio interviews, there's a lot of television interviews, but again, my charge as public health director is to protect the public's health. Durham is a vibrant community. We are an inclusive community, so again, when it comes to Mpox or any other major diseases, we want to make sure our community knows what they need to do. Big shout out to my public information officer, again, Dr. Alicia Smith. She does a fantastic job of staying in touch with the media, getting press releases out. Our social media channels are like very vibrant, very active. So that's pretty much how we do. Doesn't necessarily have to be a percentage. It's just the minute that we know it's coming and it's there, we take action.
All right, anybody else? Okay. Well, if y'all just want to come up and line up, yeah, thank you. If you want to go ahead and ask yours.
Mine's for the Department of Health as well. Mental health continues to be a huge conversation in our community. So just wondering what kind of things the city is doing to help address mental health in our community through programs, education, support.
It's a very good question, and I will say I tend to get that a lot because people sort of conflate mental health with public health. We do work in partnership with Alliance Behavioral Health, which is what we call a local mental health entity, LME. Since about 2018-19, when they went to this different model, I'll be very forthright. Part of this is like me personally speaking. Part of this is me speaking in my official capacity. I don't necessarily think that it's been the right thing to do. Going away from the county center model when we used to have the Durham Center, someone could come up to him or her and say, who's the mental health director? And we could call out a name real quick, Henry Jones or whoever. But for the most part, now if you go to a county commissioner, and I get that all the time, city councilman, county commissioner call me and say, who's the mental health director? And I was just like, we don't have one. So, you know, hot off the press, I will say, with this most recent budget, the General Assembly has enabled the Secretary of Health and Human Services, Secretary Kinsley, to have more control over the mental health apparatus. We all know that there are supposed to be several iterations of the Taylor Plan, which is really developed to really be boots on the ground and provide a little bit more services to, you know, a granular level. That has been postponed several times, much to the dismay of our lawmakers. So I would just say, you know, changes are coming. For the meantime, we still have avenues to approach, but I completely agree with you. Mental health is a big focus. In my presentation, I also mentioned that $700 million was allocated to the Department of Health and Human Services from the General Assembly, the bulk of which is going to go toward addressing mental health. So we know health is on.
Can I just say that our toughest code enforcement cases have to do with clients who have mental health issues, and we are finding that we don't know where to go to get help.
Totally agree.
And those cases will stay out there for months while we're trying to get someone to help us We have a really bad case right now where a lady's house is actually, her floor is actually falling in, and it's gonna cost us anywhere from $50,000 to $80,000 to fix her house, but we can't get her to move out. Because
She will not leave the house.
she will not leave her house, and her floor is, she's gonna fall in.
We had to get a warrant just to go in to do the inspection because she would not allow us to do any more than what we did the first time we talked to her. Because we didn't realize how bad it was till we were able to be inside and go, oh my goodness. You couldn't go from here to there without trampling over a ton of stuff. And then on top of that, the humidity in the floor has already messed up the entire floor system. So it is a very precarious situation. And like you said, we know that it's a mental situation going on, but we don't have the capacity to deal with that. Nor do we know where to send her, because she would not accept the help to begin with.
Jim, next question?
Yeah, I had a couple of questions for neighborhood improvement services. Will the Be Heard program be an ongoing program for community engagement in Durham? And if so, how are you going to keep people engaged? The next one was, what is the process for code enforcement for properties where the owners do not live in the area, and can residents purchase those properties?
Sure, I can take the first one. So Be Heard Durham is ongoing. We've collected 33 conversations right now. If you are interested in having a conversation, know someone who's interested in having a conversation, let us know. That is ongoing. We've not set an end date for when that will stop.
You want to take the next one? Okay, so the question regarding the property owners that are from out of town, we're having less and less of those these days. However, if it is first of all, it has to be a process on that property. After we have exhausted all of that, if we need to remediate the property itself, or we need to do any kind of stabilization on it or whatever, and then, because there are fees that ensue and costs, and those are not paid, then that's when they get sent for foreclosure, and at that point is when that becomes available for you to purchase the property. But there is a long time before that really takes place. We exhaust every remedy that we can resort to save the property, make sure that somebody does something with it, But in the end, if we end up being the ones to do it, then that's what ends up happening.
Yeah, so I just want to say,
They get foreclosed.
anytime we have a process on a house, and we ask the person to fix the house, and the person doesn't fix the house, and the house is in a deteriorated state where it may cause harm to the general public, we take it to our Housing Appeals Board, and they will issue an order for the owner to fix the house. And if they don't do it in 30 days, the city has to exercise its
Remedy.
self-remedy.
Correct.
And we will go in and demolish the house or repair the house. Then that cost is placed as a lien on that property. And then if they don't pay that lien off, then we take it to foreclosure. And that's an opportunity for you and anyone else to buy that property.
And this is true of the nuisance cases. After that period lapses, there too, if we have to be the ones remediating our impact team, like I said, then that results in a lien on that property as well.
And if I could say quickly, if your grass is high, it's cheaper for you to cut it than the impact team. Because right off the bat, we have to charge $250 fee.
Wow.
That's an administrative fee, which we did not set. That's set by
Not
council.
set. And
So-
then we charge for each vehicle that has to go out there, there's a fee tied to that. Then the staff salary, that's tied to that. So it could cost you $500, $600 to.
For
cut
a simple amount.
And you could have grass cut for $50.
Does anybody here know, if I may ask this question generally, how high can your grass be before you actually incur a citation?
Repeat.
10 inches.
Who said 10?
I think I heard someone over here.
Yeah, once you get to 10 inches and above, you're already in violation of the ordinance. So what we recommend is please keep it below 4 inches and we're good to go. Does that happen? In the spring, we get flooded with calls regarding that particular situation. And our bandwidth gets really narrow at that point because we have so many cases come in around that.
All right.
Yes, sir.
So, in past weeks, we've been able to ask a question each. So I've got one question for public health and one for improvement services. For public health, could you give an example of a city or county outside of the state that's doing something innovative, and if brought to Durham, would be a game changer for our population, for improvement services. What needs to be true to continue and expand the home preservation program so that residents who want to be in compliance and stay in their home but don't have the means to do so can get that support.
Happy to start. I would say, we always look toward like the larger counties, if you will, and I'll just say, Mecklenburg County has done some things that Durham has done, but they've taken it to a step above. We've always had Bull City United, Bull's project bill as far as violence interrupters. And I think they do a very good job in tandem with City Council appropriating funds and having additional census tracts. I would love if it were housed in the Public Health Department, whereas Mecklenburg set up an office of violence prevention in the health department. So again, I say we've already done it because we sort of like were the originators in doing it. It's been taken out of the health department and now elevated to a county department, which is the Community Intervention and Support Services, which houses Project Bill, Bull City United, and My Brother's Keeper. So I commend it because now it's elevated beyond public health. It's a department just like public health. But again, it's a public health intervention when you're talking about violence prevention, injury prevention, firearms prevention. They follow a public health model, so I kind of think it should be in public health, but I'm not complaining because I got enough on my plate as well. But I will just say, I think Mecklenburg, I tip my hat to them because they're very innovative in setting up that office, which in turn allows it to get more grant monies and all of that other stuff.
Neighborhood Improvement Services are what we call NPP program.
Neighborhood Preservation.
Neighborhood Preservation Program. We tried since 2018, 2019 to get the funding from that, asking City Council to give us $150,000 just to pilot it. And it took us just as long to get the $150,000. Thanks to our new city manager, Wanda Page, she made it happen, working through our deputy city manager, Keith Chadwell. In order to keep that program going, we need to have continued funding, correct, another $150,000 plus or more. And at the time when we got the money, we had 60 properties in our backlog, and I think we've done maybe 15.
And we have been able to maybe really put our hands on at least 12. It's about as many as we've been able to do.
Right.
Because
Yeah.
it takes money to be able to do some of those things.
And these are properties that have code enforcement violations on them. They really need to be fixed. These folks don't have the money to do any of the work that needs to be done. So we've been begged to say, we have these properties that are they're unsafe. People need our help, and we need it not to be pushed out.
And if I may just
Go ahead.
add a little bit to that, Constance, the premise on this program is to keep folks that are original to Durham in their homes.
In there.
Because if they cannot afford to make those repairs, what do you think is going to end up happening? Some big, sly developer is going to come in and offer them whatever. They're going to sell their home. They have lost their home now. They have nowhere else to go. In today's market, even people that have $300,000 homes can go out and buy a new home. Even with that much equity they may have in their house, these people have even less. They have nowhere to go. They lose their homes, and now you got a mega mansion coming in the spot where a nice, livable house was, back in the days when they purchased their home.
And
so it's moving,
We've
yeah.
seen that happen.
And so we're losing community cohesiveness because of that. And I think that is unfair. It just shouldn't be that.
Yeah. Thank you for
So-
your question.
Thank you for that.
Are there partnerships with nonprofits or anything of that nature that the city does to help in those circumstances to help third parties?
Yeah. Right now, we have a partnership with Rebuild, Together the Triangle. They were lucky enough to get funding from the ARPA funds that were distributed, during the COVID, pandemic. And that's part of what they do. They actually go into distressed homes and folks that have no financial means to make those repairs and assist them with making those. They do have to meet a financial threshold, of need, but, at least it's a resource. Because Habitat, which is another resource that we used to rely on, is tapped out. There is such a backlog that when we ask them to get in touch with them, they always come back to us and say, it will be 3 to 10 years before we even see any kind of anything. And then it's only partial repairs. It's not gonna be a complete, work done on whatever is needed, so.
So RTT
Piecemeal.
is a major partner. They
Yes.
do the work. They go out and do the assessments, and actually they do the work. They bring in subcontractors to do the work.
And if I may say, they do it at such non-competitive pricing that really, they're barely breaking even. But they're doing it because, again, it's a community building enterprise. It's not about making a profit, if that makes any sense. So, yeah, and like I said, it was one of those programs that we fought long and hard, and we made the case to administration after administration, and whoever will listen, that this is what is needed. And we're hoping that this will continue. Once they see, if we were able to do that much with no money, that hopefully with a little bit of funding and the things that are being done now, once they see what happens, they will go, yeah, it's working, and we need to invest in it. So.
Thank you. We have time for one more question. Is there anybody else that would like to ask one? No? All right. Well, I just want to say thank you so much. Can we give a round of applause? All righty. So that's a wrap, y'all.